Hi friends, let's talk about what really happens when you quit sodium salt, because that's what all the experts all wanted to do, right? But how can we do it safely when sodium is essential? So in this video, you'll discover what really happens when you stop adding sodium to your body, your blood pressure, your weight, your muscles, and your cravings. Because it's not just for flavor. It's actually a tool the food industry uses to shape how much food you eat. So if you want to master your health, then it's essential to master sodium physiology. And you all know sodium is essential. Without it, nerves won't fire, muscles don't contract, and blood volume collapses. But a salt deficit isn't the problem in this modern diet, right? The problem is a sodium imbalance layered on top of low potassium and low magnesium. And that combination rewires how your kidneys, your blood vessels, and your hormones behave. So the moment you reduce sodium, it's not just from the salt shaker, but the hidden sodium which hides in your food. And we'll talk about that later. Then your kidneys will notice. Literally within hours, your kidneys will reduce sodium reabsorption in the renal tubules. Water follows sodium. And this is why many people notice that they actually urinate more on day one. So when sodium intake drops, your kidneys no longer need to hold on to water to dilute the excess sodium that is in your bloodstream. Blood volume begins to contract slightly, not dangerously, just back towards kind of a normal blood volume. And your blood pressure will often drop within 24 hours, especially in salt-sensitive individuals. Now, this isn't a placebo effect. It's actually a hemodynamic natural process. And this is particularly dangerous for people who are taking blood pressure medications. Why? Because think about what your blood pressure medication is doing. It's actually preventing your body from naturally compensating for changes in your lifestyle. So when you reduce the salt intake, when your blood volume decreases, your blood pressure decreases, you gotta increase your heart rate. Hence, if you are taking medication that prevents that, you really need to talk to your doctor before you change any sodium in your diet. And again, we'll talk about where you're actually getting sodium from. And I can guarantee you, it's not from just your salt shaker. Please contact your own personal medical provider as well as your own medical physician so that they can prepare to taper you down on your blood pressure medications if you're going to reduce the sodium salt in your foods. Because when you reduce sodium properly, you will see a dramatic changes in your blood pressure. And this is no joke, folks. And likewise, when you eat a lot of sodium, basically when you go out to eat, you will see dramatic changes in your blood pressure on the opposite way. Many people feel it the same day or the next day. Blood pressure is regulated more by a balance between sodium and potassium. And of course, your other hormones, as well as magnesium. But these three minerals, they control where the water goes, how your blood vessels contract, and how nerves and muscles signal. So when that balance shifts, your blood pressure will follow. However, when you increase sodium, it actually stiffens the smooth muscle that's around your blood vessels. That makes your arteries less able to relax. And that's why when you remove sodium, your blood pressure drops because your arteries now are relaxed. You may also feel lighter. And that's not fat loss. It's actually water weight that's leaving the vascular and interstitial space. Your rings may feel loose. Your ankles will look less swollen. And your facial puffiness actually decreases. People often say, my face looks different. And they're right. By day 2, blood pressure changes become more consistent. So there's less sodium, which means less stiffness in the endothelial lining of your arteries. This allows nitric oxide signaling to improve. Now your blood vessels, they relax more easily now. And this matters because persistent high blood pressure or stiffening of your arteries is not just about force, it's about resistance. And salt increases resistance by making your arteries less responsive. When sodium drops, vessels regain flexibility. Your edema improves, the ankles, your calves, your hands, and even your abdominal bloating often reduce. And that's because excess sodium, it pulls water into the interstitial space in between your tissues. So when sodium drops, the fluid is able to return to the circulation and then it's excreted out by your kidneys. You may find that your shoes will fit better. And here's where things get kind of interesting. When you eat a lot of sodium salt, whether you're adding it or in your food, it actually worsens insulin resistance. It's not directly, but actually indirectly. So sodium alters your microvascular blood flow. It impairs insulin's ability to reach muscle and fat cells. It also increases sympathetic nervous system activation, which raises your blood glucose output from your liver. So by day 3 of reducing your sodium, insulin signaling becomes more efficient. Your muscles can take up glucose a little bit better. And your post-meal blood sugar, that spike may not be so high. And it's not because you change your carbs and fat ratios, but it's simply because insulin can do its job better. And you may notice you'll have less sugar cravings. Blood sugar becomes more stable. Hunger signals kind of calm down. Salted, hyperpalatable foods, they lose some of their grip over your appetite when you give it up. And the food industry, they know all this psychology. That's why they add salt to their food, because they want you to eat more. They want you to get addicted. They will add salt to whatever they want you to eat more of. So by day 4, if you step on your scale, you'll see a drop, sometimes 2 to 5 pounds. And no, this isn't fat loss. It's purely water weight. But it does matter. Excess water weight, it stresses your joints. It compresses tissues. And it can worsen inflammation. So losing that water weight significantly improves mobility, reduces pain, and it can lower your systemic inflammation. And this is also the time when people notice their abdomen just feels less tight. And that's not just because of bloating. It's reduced sodium-driven fluid that can potentially accumulate in your gut wall. So your body is learning how to manage a new water balance with less sodium. And ironically, one of the strangest things people notice around day 5 is that they feel more hydrated, even though they may be drinking less water. High sodium intake forces thirst. You're constantly thirsty. But that thirst doesn't fix intracellular dehydration. It actually expands blood volume instead. And when your sodium drops, your water is finally able to enter your cells properly. Your urine color normalizes. Your dry mouth actually improves. And your skin elasticity improves slightly. Headaches can decrease. This is hydration done right. Not flooding the system, but restoring balance. And of course, this is under a normal, healthy condition. So if you have diarrhea, if you're vomiting, if you're excessively sweating, if you're having fevers or breathing rapidly, those are not normal, healthy conditions, especially if you're throwing up. Any of those conditions that you have a problem with, you should really see your medical doctor. It warrants a personal discussion with your personal medical physician. And salt, just know that it's not immune neutral. That means excess sodium, it actually activates pro-inflammatory immune pathways, particularly in the vascular wall and in your kidneys. So it promotes oxidative stress and endothelial dysfunction. So by day 6, guess what happens to your inflammation? That signaling begins to quiet. And it doesn't cure any disease, but it can reduce the background immune noise. And then people with autoimmune tendencies, they often report less swelling and less stiffness. And that's not because salt causes autoimmunity, but it's simply because sodium excess amplifies inflammation. And after 7 days without any added or hidden sodium, you learn something powerful. How much salt was controlling your drive unconsciously to seek for more salted foods. And you'll notice your blood pressure is at a lower baseline. Your swelling or edema is reduced, your weight is down, your blood sugar feels more stable. And you're not so hungry. That's calmer. Your thirst is not excessive. And food just simply tastes different. They actually taste better. You can actually taste the food you're eating and not just all the salt that they've added to make you eat more food. You're changing your taste receptors because they're no longer desensitized by the constant salt overload. So this means you've reset your baseline. And you may notice the same foods you liked before is not as enjoyable. But if you just stop adding sodium to your food from a salt shaker for 7 days, you probably won't see or feel much different because the majority of the sodium in your diet is not from added salt. Most people, they don't realize that most of the sodium in their diet is already hidden in food and drinks. Foods that use sodium to preserve and prepare our food have the most amount of sodium salt. So that means if you're a sandwich person eating processed deli meats like ham, turkey, salami, pastrami, bacon, they're all loaded with sodium because they use sodium chloride, sodium phosphates, and sodium curing salts. These all add up to your sodium burden. And those sodium compounds, they are central for curing, preservation, texture, and color stability to sell you more of those items. Think about it. When you leave meat out, when it's old, it turns brown. They don't stay pink and red unless sodium compounds have been used. Salami and pepperoni are amongst the most sodium-dense meats. They average 1,800 to 2,300 milligrams per 100 grams. Now, just a few slices can contribute 500 to 700 milligrams. So that means a pizza with 20 or 30 slices of pepperoni, it may not look excessive, but just the pepperoni can already represent half to nearly all of the 100 grams in sodium. What's even worse is saltpeter, which is used to cure and process meats. Saltpeter is simply sodium nitrate. After you consume it, bacteria in your mouth, as well as your gut, it converts them to sodium nitrite. Nitrite is far more reactive. And in an acidic environment, basically your gut, or during high heat cooking, nitrites react with amino acids from the proteins, the meat part, to form N-nitrosyl compounds, commonly known as nitrosamines. And these compounds are the core cancer concern. Nitrosamines are problematic because they damage DNA. And once you absorb it, they are metabolized in the liver into highly reactive intermediates that form DNA adducts, meaning they bind directly to DNA bases. And this interferes with normal DNA repair and increases the likelihood of mutations during cell division. And over time, repeated exposure, it raises the risk of malignant transformation, especially in rapidly dividing tissue like your colon. And this is why not only should you not use saltpeter, but you shouldn't eat foods that contains sodium nitrates, even if it's all natural. And this is very separate from the overall added sodium that you get from all of your foods. Most health organizations converge on a physiological target of about 1,500 milligrams of sodium per day, with an upper safe limit of about 2,300 milligrams per day. The lower number reflects what the human body actually needs to maintain good blood volume, nerve signaling, and muscle contractions. And the higher number really reflects the point beyond which population level harms are noticed, especially blood pressure rise, which become consistently measurable. Now, jerky can range from 1,500 to 2,500 milligrams per 100 gram, depending on the drying method and seasoning. And because it is dehydrated, sodium density is especially high relative to volume. Smoked and cured fish like smoked salmon or lox, that typically contains roughly about 1,200 milligrams to 2,000 milligrams per 100 grams. And so even though you're eating tiny portion sizes, well, it's not so tiny when it comes to sodium. Are they really that healthy? So if this is your diet and you want to give up sodium, unless you give up all those foods with added sodium, all those processed meats, you really won't see any health benefits. And I know salt tastes good, but let's face it, you aren't eating it for sodium content, right? Now, why do we even need added sodium in our food? Can't we just eat food and get sodium? Absolutely.
Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
Did you know that you can actually get the majority of your daily sodium requirements just from eating natural, minimally processed whole foods? And how do we know this? Because there are people in this world who can't go shopping. They don't have a supermarket. They're called indigenous and traditional populations that have access to only foods that they can gather or hunt. Many of these groups, they naturally consume sodium in their diet, somewhere between 500 and 1,500 milligram range, almost entirely from whole foods. And guess what? These populations had exceptionally low rates of high blood pressure, stroke, age-related blood pressure rise. So this means their blood pressure did not creep up when they got older, which strongly suggests that our lifestyle, which includes high sodium intake, not aging itself, is driving our modern rates of high blood pressure. So if you eat like the indigenous population and eat a diversity of whole foods high in fiber, it's probably okay that you skip your salt shaker as well as ultra-processed foods. But that's not our food landscape. The recommendations that have been shaped today are because we live in a modern food exposure world. We're not eating food for survival. And unfortunately, ultra-processed foods that are low in sodium really won't supply your daily needs of sodium. For a person to do a low sodium diet properly, they really need to eat real whole foods that are unadulterated. If you're getting it from a box or a can, you should question that. So obviously, sucking on candy is not going to meet your sodium needs unless that candy has added salt. Historically, sodium intake has been low because salt was scarce. But that dramatically changed since the early 19th century when industrial mining, improved transportation, and mechanism evaporation allowed sodium to be cheap and abundant and a reliable commodity. So this is alpine salt. I got this from an alpine mine. And the 1800s, salt was no longer a luxury, but it was actually a staple in every household. But it wasn't until the 20th century, after refrigeration, that food processing expanded salt to unnecessarily preserve food. But that didn't stop the food industry because they knew they had to use it for flavor and to improve texture. It honestly just masks low quality ingredients so that they can give you cheap meat and it doesn't taste metallic. And it also extends their shelf life so that they can sell you food for longer. So today, the average intake in many countries sits around 3,400 to 4,000 milligrams of sodium per day, almost entirely from restaurants and processed foods. The guidelines are therefore corrective, not restrictive, aiming to bring our salt intake back to natural levels, especially to help our kidneys, our blood vessels, and our muscles. And that's why if you eat out a lot, if you're buying restaurant or fast foods, especially, let's say, a burger and fries or a combo, maybe Chinese takeout or any other takeout loaded with sauces, you're eating sodium layered into meat, the bun, the sauces. It all adds up. So take a standard cheeseburger. That burger usually contains 900 to 1,300 milligrams of salt, even though it doesn't taste salty. The beef patty itself contributes about 70 to 100 milligrams. And then the bun adds 200 to 300 milligrams. The cheese adds 150 to 250 milligrams. And then you have the condiments like pickles, ketchup, mustard, or a special sauce. That will add 150 to 300 milligrams. So if the patty is pre-seasoned or processed, sodium can climb even higher. In fast food or sit-down restaurants, it is not uncommon for a single burger to reach 1,400 to 1,800 milligrams. A medium order of fries, that will add another 300 to 500 milligrams of sodium, depending on your portion size and how heavily they are salted. Fries are often salted immediately after frying, and that oil helps sodium adhere efficiently. That increases your sodium density per bite. And then you're dipping it in ketchup. That's America's favorite vegetable. And that sodium increases even more. 1 tablespoon of ketchup contains 150 to 180 milligrams of sodium. And most people, they use 2 to 3 tablespoons just to eat their fries and burgers. That adds another 300 to 500 milligrams more. And they haven't even noticed much saltiness because the sugar masks it. So when you put it all together, a burger, fries, ketchup meal commonly delivers 1,600 to 2,300 milligrams of sodium. And in many restaurant settings, this can actually exceed 2,500 milligrams. That is over an entire day recommendation, the upper limit of what we should intake as sodium salt. And this is before you've even had drinks, sides, or desserts. So if you really wanted to quit sodium for 7 days, you're really going to have to stop buying takeout. So this means, what are you going to cook, right? If you're not normally cooking, you may buy canned foods, canned soups and broths. Guess what? Canned soups and broths, they can deliver nearly half a day's sodium in one bowl because the salt is used for shelf stability as well as flavor. So don't buy canned soups and broths. And if you do, buy a low sodium version. Now, when I was a kid, my mom used to love canned soups. And in fact, we always had canned soups around in the cupboard because that was her go-to quick meal. And unfortunately, she had high blood pressure for a long, long time, which she did not address properly. She didn't appreciate the gravity of the situation and what high blood pressure means to her brain. And I can tell you, it greatly contributed to her dementia. Unfortunately, she never changed her diet on time. She ate sauces like soy sauce, chili sauce, Thousand Island dressing, restaurant foods. She loved their soups. And all of those are stuffed with a ton of added sodium. You don't even have to add your own. And unfortunately, if you're not willing to give up those items, you're really not going to truly be quitting sodium. And as a latchkey kid, I ate my fair share of frozen foods stuffed with cheese. And you guessed it, frozen items like pizza and cheesy casseroles. They hide sodium in the crust, in the cheese, and the sauce, the processed meats, all of it simultaneously for you to eat more of their food. It's really hard to get away from sodium in processed foods because they use that to hide old meats, and they know it makes your food taste better. And sometimes you don't even notice the salt. Ever use sodium as a leavening agent like sodium bicarbonate or baking soda? 1 teaspoon of sodium bicarbonate contains 1,250 to 1,300 milligrams of sodium. That is over half of the daily recommendation for the upper limit. So a single teaspoon can almost hit the daily intake. Well, what makes it especially sneaky is that baking soda doesn't taste salty, so it doesn't trigger the same sensory warning that table salt does. And in baking, that sodium is hidden across multiple servings. A recipe using 1 teaspoon of baking soda divided into 8 portions still delivers 150 to 160 milligrams of sodium per serving, just from the leavening agent. That's before accounting for salt, baking powder, or any other processed ingredients. And that is why breads and baked goods, which don't taste salty, but rely on sodium-based leavening agents and preservatives, they make bread one of the largest daily sodium sources in many people's diets. And of course, you can skip the baking soda by using yeast as a leavening agent. And obviously, if you're into snack foods like chips and crackers and pretzels, they will give you lots of sodium because they are engineered to deliver sodium rapidly and repeatedly, driving both fluid retention and appetite. And I mentioned this before, condiments and sauces, including soy sauce, teriyaki, ketchup, barbecue sauce, they are full of sodium. And that includes salad dressings. They can all quietly double your sodium intake when you use it generously. And don't get me started on processed cheeses and cheese substitutes. That's where sodium controls the texture, meltability, and shelf life. And it's another culprit of sodium salt in the American diet. And that's why pizza is a super source for sodium. If you're in college, you probably frequent instant foods such as ramen, box mixed rices, maybe frozen entrees. Well, all those easily prepared foods, those microwavable foods, they rely on sodium as their primary flavor background. And don't think you're adding to your health by eating pickled and cured foods. That includes pickles, olives, sauerkraut, and cured fish, which historically they were preserved with sodium. But now they just add more excess sodium to on top of a pretty sodium heavy diet. And what about those electrolyte drinks? Electrolyte packets, they sell $2.77 billion a year, which is 1/10 of what blood pressure medications make, which is over $20 billion a year. So do you think your son or daughter, after playing soccer a little bit for an hour, really needs electrolyte packets when they're eating baked goods for breakfast, eating chips and crackers for snacks, and then they go out with their friends and their teammates to munch on pizza and hamburgers and fries? Come on, folks. An hour or two of running around in the sun is not going to use up all that sodium if you're eating. And it's really not just processed food. Sodium is also used to prepare food. Ever brine a turkey? Many people think it prevents the turkey from being dry. So how does that work? First, the water moves out of the muscle cells from the turkey in the beginning due to osmosis, since the outside salt water is more concentrated. And then eventually the salt moves inside the muscle cells. This early water loss is why meat can look slightly shriveled at first. As salt continues to diffuse into the tissue, the concentration gradient evens out and water begins to move back into the meat. But that brings dissolved salt with it. And the final result is that the meat contains more total water than it started with. But that water is now bound differently. But another important chemical reaction happens. When salt gets into muscle tissue, it actually causes the protein to denature, one of the main muscle proteins. Salt causes myosin filaments to partially unwind and repel each other. Now this creates more space within the muscle tissue to trap more water. That sodium actually raises extracellular sodium concentration. This then pulls water out of your cells initially, then leads to fluid retention in the spaces between the cells. So your skeletal muscle fibers, they respond by swelling in the interstitial space rather than inside the cell, which then creates a feeling of puffiness, stiffness, and reduced flexibility. And this is why high sodium days often come with really tight calves, heavy legs, and a sore feeling, even when your muscles haven't exercised. Sodium also changes muscle protein behavior, but not in a good way. So chronically high sodium, that actually increases the calcium influx into the muscle cells. And this interferes with normal calcium reuptake by your sarcoplasmic reticulum. Now, calcium is what turns muscle contraction on and off. So when your calcium handling is disrupted, your muscles actually stay partially activated. This leads to a baseline kind of tension, cramping, twitching, and poor relaxation. And this may be especially noticeable at night or during rest. So when you start giving up sodium in your food, the sodium will then slowly, it comes out of your tissue, and then ultimately it gets disposed of by your kidneys. That means you have less fluid retention, and you will notice that you will be just less puffy, more flexible, kind of feeling loose. And now, of course, the amount of sodium that you lose, that's highly dependent upon your kidneys. So if you have any kidney issues whatsoever, make sure that you speak to your medical doctor, your nephrologist, and just follow whatever they tell you. And another major effect is on smooth muscles, which lines your blood vessels and your entire gut. And excess sodium, that actually stiffens your vascular smooth muscles, making arteries less able to relax. This kind of raises your blood pressure and reduces your blood flow to your skeletal muscles. And this impairs really oxygen and nutrient delivery. And in your gut, that sodium also stiffens the smooth muscle there. So this can slow motility, contribute to feeling bloated and discomfort. So when you cut out the salt, you'll also notice that your blood pressure will rapidly fall. And we addressed this earlier. And again, this can be really dangerous if you are on blood pressure medications that already suppress your heart's ability to compensate. And this can dramatically happen within a couple of days. And yeah, that's how quickly people can correct their blood pressure if they really wanted to. But again, if you're on blood pressure medicines, you should really talk to your own personal medical doctor to make sure that they know that this is your plan so that they can adjust your medications accordingly. So be sure not to change your diet, even your sodium intake, until you speak to your own medical doctors. And the reason why your blood pressure has been persistently high when you eat too much sodium is because it prevents your smooth muscles from relaxing by displacing other minerals, like your potassium and your magnesium. And sodium excess increases urinary loss of the potassium and magnesium, as well as calcium, minerals that your muscles require to relax, generate ATP, and prevent cramps. And this mineral imbalance explains why people can have muscle tightness or weakness even when their sodium intake is high, and why magnesium deficiency often coexists with high sodium diets. So unlike culinary brining, your body cannot localize sodium exposure to just one tissue. And when your sodium rises in your food, hormones like aldosterone and vasopressin, they attempt to compensate by retaining water, which increases plasma volume and edema. So over time, muscles become less insulin sensitive, mitochondrial efficiency drops, and recovery after exertion just simply worsens. Your muscles may look fuller from water retention, but they function less efficiently and fatigue faster. And the most important distinction is really duration. Brining meat is short-term and controlled. Excess sodium in the body is chronic and diffuse. It keeps your muscles in a low-grade stress state, semi-contracted and overhydrated yet undernourished. This is why reducing hidden sodium while increasing potassium-rich whole foods that often improves muscle relaxation, reduces soreness, and lowers blood pressure. And of course, restores normal muscle responsiveness within days to weeks. And what are foods rich in potassium? Leafy greens and beans. Now, people only think about sodium and controlling blood pressure, but when you eat sodium, it leaks out of your blood vessels and it gets trapped into your tissues and it brings with it water. So when sodium intake is chronically high, your blood compensates. The kidneys, they start retaining water to dilute the sodium in your blood vessels. Then your volume expands. Now pressure inside your arteries starts to rise. The heart simply pumps harder. The vascular wall will stiffen over time. And insulin, the hormone most people only associate with sugar, well, that starts behaving differently. Salt doesn't just raise your blood pressure. It actually changes how your cells respond to hormones like insulin, how easily fluid leaks into tissue, and how your thirst signals get distorted. Most people, they're walking around in a state of functional overhydration, but intracellular dehydration, puffy on the outside, thirsty on the inside. But of course, there are going to be some people who believe that they won't be able to hydrate well unless they add some sodium to their water. And there is some truth to that, depending on your diet. And if you want to learn more about the best way to hydrate, watch the next video.